So today we're talking about osteoarthritis and tendinitis. Now, is it osteoarthritis or is it tendinitis? Whether it's one or the other, it will cause pain in those joints. So we're going to talk about what we can do to help keep our joints healthy. What is osteoarthritis? Well, osteoarthritis is a degenerative joint disease where the protective cartilage wears down over time. It says that 1 in 7 adults can suffer from arthritis, and it's more prevalent in women. So we suffer a little more than the men do. What are some of the causes? It can be related to your age, genetics, or injury. A lot of people younger have arthritis because they've suffered injury. That would be my case. I suffered an injury when I was 16 and has had problems about 20 years to now. So when I was young, it didn't cause me any problems, but when I hit about 35, I started having some problems. And Dwayne can attest to that. He had an injury. He's an athlete, and I'm sure he's starting to feel some things too. So sometimes it's unavoidable. We must keep our weight as healthy as possible. What is recommended for our height to keep the joint stress down. Every pound that you're over your recommended weight exerts about 4 pounds of pressure on those joints. What are those joints that can cause arthritis, that have arthritis? You have your knee joint, your hip joint, your ankle joint, your shoulder joints. Those are the weight-bearing joints. You don't think of the shoulder as a weight-bearing joint, but it actually is. So like when you lay in the bed, you have pain. That is actually a weight-bearing joint. You can have arthritis there too. And that's where most people suffer. They suffer with their knees, hips, and ankles and shoulders. There's usually not too many problems with the wrist or hand unless you're a boxer and you fight a lot. So we're going to focus on the ones that I mentioned earlier. So what do we do to keep ourselves from having so much pain around those joints? Well, you want to stay as active as possible. You want to strengthen the muscles around those joints, and that will help prevent further injury. What are the things that we can do? Strength training. When I say strength training, you can do weight-bearing exercises. That's using your own body weight or using bands or even using dumbbells. That will be for the more advanced people. But if you're not a novice or an expert with using dumbbells and weight machines, you can just use your own body weight. And when I say use your own body weight, that means like doing squats. When you sit down in a chair, that motion is a squatting motion. So when you do sitting in a chair, getting up, sitting down, those are considered squats. And then we've even found that doing deep squats helps strengthen the muscles that are around the knees. The knees are the ones that most people complain about the most. So you want to keep those thigh muscles, the hamstrings, really strong. So we do strength training. We walk. We have to have our legs to walk, to move around and get around. You do yoga. Yoga actually strengthens and lengthens the muscles, and it actually helps the ligaments and the tendons to stay strong and healthy. And then there's also Tai Chi. Tai Chi is a exercise of motion that's really popular in the Eastern countries or continents, but it actually is becoming popular here in the United States and the Western Hemisphere. Tai Chi helps with balance. Balance is very important. Excuse me. So we want to continue with doing that and then stretching. As we age, our tendons and joints become more stiff and ankylosed, and so it becomes very, very important that we stretch. A lot of times we skip that part, and I am guilty of that by not stretching as we should. So if we were to stretch better, that would actually help with the lubrication and the movement of the joints so you don't suffer so much with the arthritis and pain. And going back to the quadriceps, which are the thigh muscles, those are the shock absorbers and the calf muscles. So if we can keep our thigh muscles and our calves strong and flexible, we shouldn't have any problems. And once again, by doing that, you want to make sure we're doing strength training, walking, exercising, and keeping good health, okay? Now, also, it's always so important that we eat right. And you know, all my seminars that I've had, it always go back to eating right and choosing the right foods. So, When you're overweight and when you're carrying excess weight, most of the time it's fat. Fat creates inflammation. So we want to make sure that we keep our fat level down. Remember, we've talked about fat in the midsection, which causes that visceral fat that can cause you to have diabetes, and it causes inflammation. It can cause you to have a fatty liver, and it causes all these problems around your heart. So fat, once again, causes problems with your joints because it causes inflammation. You want to avoid smoking. You want to avoid vaping. You want to avoid too much alcohol. Actually, drinking some wine is actually good for you because it's good for circulation. It helps boost the red blood cells, especially those dark red wines. Where's hearts? That muscadine wine. So you want to make sure if you do it in strict moderation. But no vaping, smoking, heavy alcohol usage, because alcohol dehydrates the joints. It actually dehydrates the whole body. And you want to make sure that you're getting sufficient amount of protein when you're eating. The best diets to follow are the Mediterranean diets or the DASH diet. I've mentioned those before on my lectures, so you want to make sure that you're getting green leafy vegetables, those olive oils, those olives, those avocados, those red tomatoes, if you like tomatoes. And that DASH diet is slightly different from the Mediterranean diet, whereas it reduces the amount of sodium you take in. Normally, on a 2,000 calorie per day diet, you would take in about 2,300 or 2,000 grams of sodium. However, when you do the DASH diet, you reduce that down to about 1,500 milligrams of sodium. Sodium is just salt. So, and you want to stay away from canned foods because sodium is added to canned foods to preserve them. That's why we are big on fresh fruits and vegetables or frozen. And the extra sodium is not added to that. And you'll find if you read the label, remember I'm a big stickler on the ingredients in your foods. The food should have just one ingredient, whatever that food is, and no extra stuff. But it can go up to 3 because sometimes you may have to have a little sodium to preserve it. So remember, if you have a long list of ingredients that are in those foods, those are processed foods or ultra processed foods, and that's not good for you, and it actually increases inflammation. And a lot of times those ingredients that are in those foods, we already talked about that, are different types of sugars. Remember, we talked about all the different names for sugars. Well, they put all that stuff in the food to preserve it so it'll last a long time. And most of the time you'll find those foods in the middle of the grocery store and not along the perimeter. We've talked about that. You want to choose your foods from the perimeter of the store. That would be the produce sections, the meats and cheeses, and dairy if you eat dairy. Some people can't tolerate dairy, so don't even worry about that if you're not a fan of dairy. And I understand why. That's a whole nother subject we can talk about. That'll give me something else, another subject to embark on. Now, let's talk about tendinitis. Tendinitis is where the tendon insert into the bone. That can get inflamed when you have overuse syndrome. When you work out a whole lot, you do a lot of exercising, you don't stretch, and you don't replenish your fluids and your protein. As we get older, and older adults, their appetite tends to diminish and you don't eat as much. So you want to make sure you're getting adequate vegetables, fruits, and your protein. And you want to make sure you're stretching and resting when you do embark on exercising and trying to keep yourself healthy. Now, tendons are a fibrous cord and it attaches the muscle to the bone, like I just stated earlier. And there's not a lot of blood flow to that area, and it's very easy to get that inflamed. And you wind up developing tendinitis, usually like if it's one side of the body where you have arthritis, or if it's from an injury, you have a tendency to compensate that bad side and then compensate with the good side, and then that's where you get the tendinitis in the opposite leg. Usually, like just say if you have arthritis in your right knee, you'll probably wind up developing tendinitis in your left hip, which sounds weird, but that's usually how it works, or all the way from your left hip down to your left knee and down to that ankle. So you want to make sure you try to keep that right side strong so you don't have tendinitis in the opposite side of the body. and you'll be trying to figure out what the heck is going on, okay? So what we do, once again, you want to keep moving. Even when you feel stiff and you feel like you're hurting, you want to do some things such as yoga, tai chi, and move so the tendons and the joints don't become petrified or ankylosed where they don't want to move. And I'm sure you hear that grinding sound when you're walking with arthritis and tendinitis. A lot of times it's actually tendinitis when you hear more of that popping and clicking, and the arthritis is more the grinding sound. So you want to move that joint that you're having that sensation or that feeling in, so you can lubricate it to get some kind of fluid movement in there so to feel a lot better. So just say if you're suffering from hip tendinitis or arthritis, you want to lay in the bed, pull your knees into your chest, move, lift that leg up in the air, move it around, try to move it as much as you can to get it loosened up so you can start your day. Because the more you sit and don't do anything, the stiffer you will get. Now, where we've talked about tendinitis can be in the shoulders from reaching, lifting, and pushing. And you can strain it from certain sudden movements, like if you hadn't been doing anything for a long time and you decide you want to help somebody move some furniture or do something like that, and you pull and lift something, you can develop a strain in those areas and cause an injury. And usually you see it in people who do a lot of gardening, machine operators, using the computer a whole lot, sitting in certain ways. That can actually cause tendinitis. So what we would like to do is make sure, once again, that we stretch, move around, move easily, gingerly, get yourself going, and then get into your activities. And once you finish, you want to get in some warm water so the joints are still warm, and then you do your stretching. So you want to stretch a warm joint. You don't ever want to try to stretch a cold joint, because that's how you can tear the tendons and the ligament, okay? Now, what else can we do for treatment other than the stretching and physical therapy? The things I described are just physical therapy. You can take pain relievers. You got your Tylenols, you got your ibuprofens, you got your Advil, your Aleve. You can take those. Those are the anti-inflammatories. Tylenol is just considered a pain reliever. It doesn't have any anti-inflammatory properties to it. It just relieves pain. Whereas Advil, Aleve, ibuprofen, Motrin, those are anti-inflammatories. It actually works at a different site in the body where it decreases the inflammation. However, you know, these medications have side effects. We can go back to the Tylenol. If you take too much of that, it will affect your liver. If you take too many anti-inflammatories, it will affect your kidneys, or it can affect your stomach. Whereas the ibuprofens, the anti-inflammatories, can cause gastritis or ulcers. And the anti-inflammatories can also cause renal failure. There was a basketball player that played for Miami. I can't think of his name. He was taking them, he was playing it, and he wound up with renal failure. And he was young. He was like in his 40s. And he had to get a renal transplant. So you want to be careful with those. So that's why I try to talk to you guys more about natural ways to keep the joints lubricated and healthy instead of taking medication. Even though I prescribe medication, I'm not a fan. Can you believe that? So also we can do steroid injections, and we can give you steroids. Steroids is a potent anti-inflammatory. Steroids actually decrease inflammation way better than the Advils and the ibuprofens and all of that. However, there are severe side effects to that medication too. On steroids too long, you can develop diabetes. You can develop glaucoma. The bones become weaker. You develop osteoporosis. So steroids we use very judiciously. We don't use them often. Only when a person is in severe pain, we just try to get them some relief. We give them the steroids and the steroid injections. Then there's hyaluronic acids. There's mixed reviews with that. What that is, that's collagen, and we inject it directly into the joint where you're having the arthritis to try to help cushion it. And I've sent a lot of my patients to the orthopedic specialist, and they've had it done. Like Rooster Cartilage is like a brand name for one of them. Hit or miss, doesn't work very well. Then you have PRP, which is platelet-rich plasma. That works really well. I can attest to that. Dwayne can attest to that. I was hoping another one of my patients would join in. I did it for her. She would let you know how well it works. A couple of my patients. PRP, you say, what is that? PRP is platelet-rich plasma, where we take your own blood. I think Horace had it done too. Horace had it done to his Achilles. You take your own blood, we spin it down, and we extract the plasma, the platelets inside the plasma is very concentrated and rich, and we inject it into the area where the arthritis is. And it actually has regenerative factors in it where it actually helps the cartilage regrow, or it cushions it really well. And I am a witness, and I can tell you it does work really well. And of course, the insurance company says it's experimental and they don't pay for it. So they said they can't figure out a way to bill you for your own product, so they don't cover it and pay for it. So you have to pay out of your own pocket. And a lot of people don't like to pay for things when they feel like their insurance to pay for it. So there's a fight there. But if you really love your body, you would pay, to keep yourself healthy. Then there's other things such as physical therapy. We've talked about dry needling, where you have an acupuncturist that will dry needle you in certain places where you have pressure points. That will help with the pain. And of course, the last resort is surgery. Well, no one wants surgery. But that you can get a total new knee or a partial knee, and see if that works out for you. A lot of people say it works really well, but once you get a knee replacement or a hip replacement or a shoulder replacement, it only lasts 15 to 20 years. So just say if you were to get that done when you're 50, you got to get it done again at 65 and again at 80. So that's something to think about. And then, of course, we want quick fixes. So there are supplements that we want to try, but most of those, they don't work really well, but you can try them and see. There's chondroitin glucosamine. You take that. That's supposed to help rebuild cartilage. You have turmeric that actually helps at the inflammation markers where, you get the inflammation. And collagen, we spoke about that. And vitamin C helps with the synthesis of collagen. So taking vitamin C does quite a bit. That's why that's the big push now, collagen for your face. It helps build up the collagen, so it takes away wrinkles. So you can use vitamin C on your face to help rebuild collagen for your face. But we're talking about knees and osteoarthritis, right? And then, of course, vitamin D, my favorite vitamin. I love vitamin D. It does so much. Vitamin D helps your body absorb calcium, and it helps the bones become dense. So vitamin D, once again, is right there on the list. And then magnesium actually loosens tight muscles and the tendon sheath. So, once again, remember I talked about how the tendon gets tight and ankylosed at the bone. So magnesium helps loosen that. And magnesium is actually good for your heart too. So it keeps the heart from being so tight. So, and then there's one called MSM, which is methylsulfonomethane. That actually helps with inflammation. And then amino acids, and I talked about protein. Amino acids are the building blocks of protein. So you want to make sure that you get all your amino acids to help build up your protein, and that goes back to the strong muscles. So you want solid muscle mass to make sure that your muscles are strong around the joint, so it's not a lot of impact on the joint itself, because the muscles around those joints are the shock absorbers, okay? So as we get older, it is very, very important that we continue to do weight training to keep our muscles strong around the joints that are weak, okay? Now, the big thing that's popular now, it's always something that comes out popular that's supposed to fix everything, sea moss. So it has been hypothesized, and Dr. Sebi, I'm sure you guys have heard of Dr. Sebi, he spoke a lot before he died about eating sea moss because it has over like 72 to 102 nutrients and minerals, essential vitamins that helps rebuild cartilage. So where do you find these key minerals that help rebuild cartilage and keep your joints strong? The minerals are iodine, calcium, magnesium, potassium, iron, zinc, sulfur, and other trace minerals such as copper, manganese, psyllium, phosphorus, and sodium. And then also the vitamins A, D, E, and K. And I already talked about these. And then we've talked about B complex. B complex does a lot. So that's why it's so important that you eat a well-balanced diet. that has the vitamins in it. But it's hard for us to do so because the food in the U.S. is so watered down, genetically modified, processed where they want it to last. These nutrients don't occur like they should. And then, the foods aren't nutrient dense like they used to. And then people choose to eat things that aren't nutrient dense because the foods that are processed taste better because of sugar. Sugar is highly addicting. And then once you start eating sugar, the foods that occur in its natural form doesn't taste good. It's not palatable. So what you need to do is you got to withdraw from the sugar, the processed foods. Once you withdraw and stop eating those processed foods that have all that sugar in it, all these vegetables taste so good. They're so flavorful. You'll really enjoy them. And then when you go back to eating, just say a piece of bread, you actually can taste the sugar in the bread. And if you go back and if you eat a vegetable, like a carrot, you can actually taste the sugar in the carrot without adding sugar to it. So what we need to do is get ourselves off sugar. If we get ourselves off sugar, we'll enjoy natural whole foods again. And that will keep us healthier. Now, I'm pretty much done with my presentation. And if anyone have any questions about what we can do to help with arthritis, I talked about all the things that we do as medical professionals, as a physician, and then I told you things that you can do at home. So my favorite as a physician that I would like to do for you is the PRP because it works so well for me. So any questions from anybody?